Come to my YouTube channel. So today I'll be talking about the problems where the pharmacist has to face while issuing drugs. So there are some patients who come up asking for drugs, for medicines without a prescription. But let me ask you all, why was a prescription made? Why was there something called a prescription? Prescription was actually made for the doctors, where they prescribe drugs and patients have to come to the pharmacy and get it issued. But why do you all then ask for drugs without a prescription and thinking that a pharmacist is allowed to issue it without a prescription? There where the patients actually put the pharmacist into problems, where he has to either issue it or has to fight with the patient, just because the patients actually fight with us, saying that they can get the same drug in another pharmacy, or why is there a rule that you cannot get drugs without a prescription where he has been taken for a long period. But do we know that you are taking that drug for a long period? Do we know you? No. Even though we know you, we cannot give you the drug since we are not sure what you're going through, what problems, what diseases you have. So the doctor actually prescribes you, seeing your condition, your body condition, and then he actually prescribes you drugs based on that. So we are not doctors to prescribe you drugs according to it. We can only issue you drugs based on a prescription, based on a doctor's prescription. Then, taking painkillers while you have a slight pain. Sometimes the patients come up and they want some painkillers or some medicine with their problems. They want us to tell them what they have to drink when they say they have this problem, they have that pain and stuff. But we cannot do it. We are not doctors. Yeah, but for a slight thing, maybe for a headache, for a small headache, yes, we can. But if it is repeating, if it repeats the same thing every day, then you should actually show it to a doctor, because there are many reasons you get your headache. So that in that way, you should actually show it to a doctor. It's better to show it to a doctor, or else check for a day and then go to a doctor, where you can treat it. When you can't treat it, when it's not under your control. Drinking drugs more than prescribed to reduce your pain. Okay, so some patients think that if they drink their dose of drug, when it says 2 times a day, the patients sometimes drink both the doses at once so that their pain is reduced. But no, you cannot drink that way. When you're said to prescribe it only once a day, you should drink it only for that dose. If it's twice a day, it should be twice a day, where it should be 1 in the morning, 1 at night, or 1 in the morning and 1 in the evening. That should be repeated every day. So that is how you should go. And actually, a pharmacist cannot prescribe you drugs, or cannot issue you drugs more than what a doctor has prescribed, where you can say validity. When the prescription's valid, if the prescription is only valid, you can give the drug. And if it is if the doctor has said you to drink it for a month, you should drink it only in that month. not more than it. Sometimes patients think, yes, doctor has prescribed you for a month, but then if you can drink it for 2 or 3 days and then go to doctor just because you're lazy or because some other problem, that is not the way. You should drink it for a month. If the doctor says you to get the reports and come back to him, go to him. Or if he says just to drink it and then come back to him, you have to do in that way. You can't be like, okay, if he says 1 month and 3 days, it will not be a problem. Drugs, medicines are very, very powerful. That is why they are given for your pain. So you should actually think about it, not drink it after a month again so that okay, it will be fine. That is wrong. You actually put the pharmacist also into problems, because there are some patients who think, okay, if I go to the pharmacy and fight for it, you can get the medicines for the next month as well. But it shouldn't happen that way. You should not trouble the pharmacist, because pharmacists actually care for their patients. They think the patients should get well. No, because the patients actually have to get well, or else they have to get into trouble. Taking high dose painkillers like paracetamol is not a paracetamol, where some patients can take it over the counter OTC, but paracetamol plus codeine is not OTC. I hope you all know the effects of the codeine. So sometimes patients think if they could beg the pharmacist, or if they could fight with the pharmacist, they could get that drug. That is not right. You should always drink what is needed. No, like you all can't drink paracetamol plus codeine just to get high, or there are some cough syrups you can drink just to get high. It's really wrong. You should drink only what is needed and when it is necessary. Just because you want to get high, you can't drink all that, because end of the day you're harming yourself and you all might fall sick or you all might die. So you should actually respect the pharmacist and not be like you can get it from another pharmacy, because we know the other pharmacist won't do it. You can't say the pharmacist will give you all when we actually know they won't give you all. So please keep that in mind and respect all the pharmacists and be kind to them, because they are very kind to their patients. Thank you so much. Please do subscribe, like my channel, and if you want to see more videos, please press that bell button to get more notifications, and keep sharing. Thank you.